Madhok. I'm consultant bariatric surgeon based at Derby. I've been doing weight loss operations for around 10 years now, and I've been working with Allure for the last couple of years. What we can offer you is a good team who will look after you, which I think is paramount after weight loss surgery, because it's not just the operation, it's the preparation for the operation as well as the aftercare that is very important to get a successful result, and also identify when things are not going so well and how to correct it, how to give you the right support to eventually get a successful result. So weight loss surgery-wise, there are a variety of procedures available to you. All of these operations are done under general anesthesia, so you are put to sleep, and done in a keyhole fashion, what we call as laparoscopy. So typically you have about 5 small cuts in your tummy on the skin. They are about a centimeter or 2 in size, and that is how the operation is. Okay. The most common operations are sleeve gastrectomy, Roux-en-Y gastric bypass, and the one anastomosis or the main gastric bypass. So as I said, all of these are done in a fairly similar fashion. So the preparation for the operation is quite similar. What we expect you to do in the first week after the operation, how you recover, the degree of pain you may experience, what medications you need for controlling that pain, or some sickness symptoms that you may experience, what precautions we give you in terms of getting you up and about, physiotherapy to reduce risks such as chest infection and so on. They are all quite similar with all the operations. Also, the dietary changes that you make in the first few weeks after the operation will remain fairly consistent between the operation. Okay. However, the operations are quite different to each other. Laparoscopic sleeve gastrectomy is one of the most common weight loss operations that I do, and surgeons like me up and down the country as well as internationally. It is the most common operation being done. About 50 to 60% of patients with weight loss surgery will have sleeve gastrectomy. It has grown in popularity, and it has been around for the last 30 odd years. What we do at the operation is, I'll show you a schematic video. So these are the kind of cuts that we make on your tummy once you're put to sleep. And then we put in some specialist instruments to allow us to do the operation. So if I pause here, this is what your inside is like. So this is your food pipe, gullet. That's your stomach. That's all of your small bowel, which is typically about 4 to 6 meters long. And that's the large bowel. What I do at the operation is I remove almost 3/4 of your stomach. So it is a practically irreversible operation because the part of the stomach I remove is physically removed from your body. It can no longer be put back in, and hence it is completely irreversible operation. So I'll show you the with the video, and this is what we do. So if I can pause here. So this, as you can see, is the stapler line that I use to seal the stomach and divide. And the stomach that you see on this part is a part of the stomach that comes out. That is how it is. Now, one thing I'll say is what you're left with is this long, narrow stomach, which is the sleeve gastrectomy. What we could call it like a banana-shaped stomach. One of the most important part of this operation is removing this top part of the stomach. Because that releases the hunger hormone, which gives you a sensation of hunger. And after this operation, a lot of patients come and tell me that they no longer feel hungry. And that's because the signal that your brain receives from the stomach when you're hungry is not gone completely, but it is massively reduced after the operation. And that's the sleeve gastrectomy in simple terms. What it does is it reduces the capacity of the stomach by almost 90%. Typically, stomach will carry around 1.5 to 2 liters of food, liquid mixed together before the operation. And after the operation, it can only carry up to 150 minutes. So it's massively reduced. In terms of the pros for it, what is good about the sleeve is, as I said, it's a completely irreversible operation. It's got a simple design in a lot of ways. So what I mean is the operation is mainly on the stomach. I do not touch the rest of the small bowel, large bowel, nothing like that. So, and it is a good operation. If you work with it, it uses a tool to make the changes in your diet and lifestyle. You do get a good result from the sleeve gastrectomy. Mainly, as I said, it works by reducing the portion size, and also it causes some hormonal changes, the one that I mentioned about taking away the hunger hormone. It is a major operation. There are risks that can happen. One of the main risks that you worry about is things like any major bleeding or any leakage or any wide stomach. Thankfully, these are quite rare. So the chance of that, I would say, is less than 1 in 100, anything major going wrong like that. If it does happen, it typically happens in the first day or two after the operation, and we watch you very closely. We've got some excellent team to look after you on the ward, who monitor you very closely. So when you come in, my team of nurses, physiotherapists, they will look after you. They will show you the exercise that we expect you to do. I will monitor you closely. You will have your blood pressure, pulse rate checked on a regular basis after the operation. We'll check some bloods the next day. So we do a thorough check for any kind of complications that may be going on. And only when I'm happy, if there is no particular risk of any complications, then you'll go home. Typically the night after the operation, so first day after the operation or the day after. If any of these major complications are going to happen, they happen during that time. And if I spot it, then I may act on it. I will then make it a scan, return back to treatment. But as I say, these are very, very rare. Apart from that, there are a few things that can happen in the long run. In the long run, most of the patients will lose around 60 to 80% of their excess weight. And that happens typically in the first 6 to 9 months after the operation. After that, the weight loss will slow down a bit, but you do continue the weight loss for 2 years. It is important to follow the advice that you receive from our team. So regular follow-up with the dietitians, nurses, to make sure you are recovering as you would expect, and also to help and guide you at every step where you're not quite sure how things are going, or you need some specific advice about what you could eat, or certain things that you're not able to tolerate, and so on. We can give you advice. In the long run, there is no particular risk from the sleeve gastrectomy. There are a few things that I should mention. A lot of patients will experience some degree of acid reflux after the operation. That's very common in the first few months, maybe up to a year or two. And we regularly prescribe you antacids to control that acid reflux. Most of the time, as you lose weight, these symptoms get better, and you get used to the gastrectomy as well. Occasionally, reflux can be an issue where you find it quite troublesome, and in that case, we may have to continue with the antacids and or sometimes watch your diet, and that should control the symptoms nicely. And very, very, very rarely, if reflux becomes quite troublesome, then we may have to change your sleep into bypass. But I must say that is very rare. Also, other important thing is to continue with the supplements. So because your portion sizes are quite small, you do need to take supplements, which are food supplements such as multivitamin and mineral tablet, vitamin D, calcium, iron, and vitamin B12 injection. This is lifelong. You should be on the supplements, and we'll explain this in further. So the Roux-en-Y gastric bypass, it's what a lot of surgeons would call the gold standard operation, mainly because it's been around the longest. It's been around over 70 years. Most of the medical studies on weight loss surgery has been done on Roux-en-Y gastric bypass. It is, in terms of the operation, recovery, what you will notice when you come for the operation is fairly similar to any other weight loss surgery. This is a sleeve gastrectomy because it is done in a keyhole fashion. Recovery is all almost similar. So I'll show you a schematic video and exactly what it means. So once you're put to sleep with general anesthesia, we make these kind of small cuts in tummy, which are about a centimeter or two in size, and with some special instruments to do the operation. Once I go in, this is what I typically find is, which is your gullet, which is the food pipe. This is the stomach. And you have the small bowel, which is around 4 to 6 meters long. And then that turns into the large bowel, which is the labia. What I do at the operation is I make a small pouch of the stomach by dividing the stomach and sealing it. So these are the staplers that come through and they seal and divide the stomach. And this pouch will be the new stomach, and this stomach still remains in your body. I don't physically take it away. The only thing is food no longer goes into the bypass. Once I've done that, I then bring a loop of your bowel, and this connects it there. And one loop goes and joins the stomach pouch, and the other one joins the. So this is the Roux-en-Y technique. What it does is I'll show you how the food circulation changes a little bit. So the blue color shows the food coming down, and the green color shows the digestive enzyme such as bile and pancreatic. And you can see it goes down this way. It doesn't go to the main portion of the stomach at all. And the idea is that the stomach is much smaller than before, so your portion size massively drops. Secondly, whatever food you eat doesn't get absorbed till the joint between the small bowel to small bowel. And that's because it does not come in contact with the digestive juice till at this point in your small bowel. And this is when the food starts getting digested. So it has got two effects, what we call as restriction, reducing what you eat, and two, malabsorption. So whatever you eat also doesn't get absorbed completely. Typical weight loss we see is, again, 60 to 80% of your excess weight, and weight loss does vary between patients. One thing I like to say about weight loss surgery is don't just go by the actual number on the scale. More important is if you have any problems associated with your weight, such as your diabetes, blood pressure, sleep apnea, these things get better. Or you overall feel healthy in yourself, your mobility gets better, the pain in the knee or your back gets better, and generally you are a lot more active. And that is a successful result rather than counting how many stones you have lost. But gastric bypass is one of the standard operations that we do, and the results are good in the long run. Most of the time, things go very well. You come to us, to the hospital on the day of the operation, and you are out the next day or the day after. We watch you very closely during this time, though. We have certain checkpoints, as we like to call them, and as you pass them, we know that you are recovering very well. And once everything is cleared, then off you go on your way home. There are risks. These are major operations. So one of the main things the surgeon will worry about is risk of any major bleeding or leakage where I divide your stomach or do the joint of the stomach and the small bowel. I must say these things are very, very rare. And when they do happen, we will act on them, we require further operations, scans, antibiotics, and so on. So it's generally very rare. In the long run, you continue to lose weight. Most of the weight loss happens in the first 6 to 9 months after the operation. Important thing is to follow the advice from our team, follow the dietary changes that we recommend, and undertake a regular exercise to achieve a good result. Other thing is to be quite thorough with the supplements that we advise you. These are food supplements you need to take, and that is something with gastric bypass, the difference from sleeve is it has got a specific anatomy changes that I make, and as a result, there are some specific problems that can happen after gastric bypass. So as I mentioned, in the gastric bypass, I only not only do the operation on the stomach, but I also bring a loop of bowel to connect to that stomach. Whereas in the sleeve, your entire operation is only on your stomach and you do not touch your small bowel. Because of the small bowel involved, there are certain risks that can happen after gastric bypass. One of them is what we call as an internal hernia that is specific to the gastric bypass, and it can happen anytime after the operation. It may happen a decade or two after the operation as well. And there is something we will explain to you when you come for the operation. Most of the time it's not a problem, but occasionally it presents as an emergency, which then requires an emergency operation. But again, generally speaking, it is very, very rare. So the mini gastric bypass, or what we like to call it as one anastomosis, a gastric bypass, is again a gastric bypass. The term mini, we say that, but it doesn't mean that it's half a gastric bypass. It still works like a gastric bypass. In fact, the weight loss is after the mini gastric bypass is much more than what we see with sleeve or a ruined by gastric bypass. The precautions that you need to take, the preparation for the operation, the recovery, the possibility of the risk, all exactly the same as a ruined by gastric bypass or a sleeve. The only difference here is, as the name suggests, one anastomosis or a single joint. So there are, rather than two joints, what we see in a traditional ruined by gastric bypass, there is a single joint, a single anastomosis. Okay. And as a result, it reduces the risk by half. So things like any bleeding or leakage or risk of hernia, these things are there with the two joints. It is reduced to 50% because there is only one joint now. Again, weight loss is quite similar. You will see 60 to 80%, probably more so with the mini gastric bypass. Dietary changes, quite similar to gastric bypass. So initial few weeks, you are just on liquid diet, and then you go to puree, and you gradually progress depending on how you are feeling. Usually by about 6 weeks after the operation, most patients are back to eating solid food. The precautions for food supplements, such as multivitamin, minerals, that is exactly the same as gastric bypass, and that is to take. Revisional weight loss surgery is getting more common. We do get quite a bit of requests for those now. most of the time, the request is about patients who had previous gastric bans, which used to be a very common operation about 10, 15 years ago. And for a variety of reasons, either it did not work or there were complications with the gastric band, for which the gastric band then needs to be removed. And they are still struggling with the weight, still suffering with obesity, and as a result requires some further surgery, which is absolutely feasible in most of the patients. Depending upon your demographics, your weight, your BMI, we will advise you the operation that is more suitable, or depending on your other medical conditions. But we could do revision of previous gastric band to sleeve gastrectomy, to one anastomosis or to mini gastric bypass, or for full Roux-en-Y gastric bypass. Digital surgery is perfectly safe. It does take us a bit longer because when you have a previous operation, it causes some adhesion and scarring where the previous operation has been done. Typically, the gastric band will have some scarring around your stomach, and it hence takes us a bit longer to do the operation. The risks are slightly high if it is bleeding or risk of leakage where the device is similar, but still quite rare and generally done in a very safe. I've been with Allure Weightloss for the last couple of years. We started with doing mainly gastric balloon insertion, and I saw the team was really enthusiastic. The patients were very happy with the service they received, and they had some excellent feedback. And because we had queries about weight loss surgery, we have started offering weight loss surgery. And again, as a team, we have expanded together. We have put in some really strict assessments after multiple discussions, consultations, and we have got a fantastic team, not only to prepare you for the operation, but also to look after you well after the operation. So a good team of patient coordinators, team of dietitians, specialist nurses, surgeons working together. So we all seek advice from each other, learn from each other, and that is what maintains a good team ethos within Allure Weightloss. I think that's a good question because it can be confusing when you have so many choices, which one is right for you. Obviously, I would say invest some time, some of your time to read about these operations. See, one good thing is you listen to this video, so that is a good start. Plus, we have a lot of other information about weight loss surgery to go through. Finally, it will be the one-to-one consultation that you have with the team. So you will speak with our patient coordinators. They know quite a lot about weight loss surgery. They can help you. You will speak with the nurse beforehand as well. But also, many people will speak with the surgeon. They can explain to you in a lot of detail about each operation. They will go through a detailed consultation, knowing a lot about you, your past medical history, medications you are on, any operation that you've had. Do you have certain symptoms such as acid reflux and so on and so forth? And based on that, they advise you which operation will be more suitable for you. If I can say in a nutshell, if you have severe symptoms of acid reflux, generally sleeve gastrectomy should be avoided. If you have had previous operations on your tummy, especially big operations as an emergency, then gastric bypass may not be feasible for you. And there are some other considerations that we have to consider before we offer you a particular operation. If you'd like to know further about weight loss surgery or you would want to know more information, please get in touch with our patient coordinators. They will take your details. They will try to answer some basic questions and eventually guide you through. And we'll be more than happy to help you.